Hello and welcome. Talking about what happens to our bodies after we've had a baby, well, it can be really tough. So today, we're going to gently walk through the topic of perineal scarring, and my hope is to give you some really clear, supportive information to help you on your path to healing and comfort. I want to start right here with this quote, because it's so important. If you've ever felt damaged or embarrassed or even a sense of grief for the body you had before, please hear this. Those feelings are completely 100% valid. This recovery isn't just physical, is it? It's emotional too. And you absolutely deserve to feel whole again. So let's talk about it. Let's bring this whole conversation out into the open. For way too long, this has been something women are expected to just deal with in silence. But you know what? Arming yourself with knowledge is the very first step toward getting your comfort and your confidence back. Now, take a look at this number, 85%. Just let that sink in for a second. That means if you've gone through this, you are in the vast majority. It's such a shared experience, and I really want you to know that you are not by any means alone on this journey. Do any of these sound familiar? That nagging, pulling feeling, or a tightness that just won't go away? Maybe it's numbness or even sharp pains right at the scar. It can make sitting uncomfortable, exercising tricky, and it can cause pain during sex. There's actually a medical term for that. It's called dyspareunia. These are not things you just have to put up with. They're really important signals from your body telling you that something needs a little attention. But here is the really good news. There are gentle, proactive things you can start doing yourself to help your body heal. So let's dive into how a really simple technique can make a world of difference. Okay, so what are we talking about here? At the Women's Health Clinic, one of the first things we often guide women through is something called perineal scar massage. All it is a gentle way to encourage that scar tissue to act more like your normal tissue, to be more flexible, more comfortable. The timing is important, though. You want to wait until that initial healing is all done, which is usually right around that 6 to 8 week postpartum mark. So what's this massage actually doing down there? Well, it's pretty amazing, actually. It works on a few different levels. First, it helps break down any little bits of tissue that are kind of stuck together. It also encourages the tissue to get its stretchiness back. And for those nerves that might be feeling a little hypersensitive, it helps to calm them down. And finally, it brings fresh, healing blood flow to the area. It's all about working with your body to heal. Now, massage is a fantastic, wonderful first step, but sometimes your body just needs a different kind of support to get you where you want to be. And I want you to know that is completely and totally okay. Let's take a look at what other options are out there for when you need them. This chart does a really nice job of laying out the two main paths. So on one side, you've got the gentle massage, something you can do at home, no downtime, perfect for newer or milder scarring. On the other side, for those scars that are a bit more stubborn, maybe they're bulky or painful, there's a minor surgical procedure called a perineoplasty. They're just different tools for different situations. Let's be really clear about something. When we talk about surgery, this is not about looks. It's not about vanity. This is a functional procedure, plain and simple. It's for when a scar is physically causing a problem. It's causing pain, it's impacting intimacy, it's affecting your quality of life. The whole goal is to restore comfort and function. That's it. All right, so as you're taking these steps on your healing journey, it is so vital to know how to listen to your body. Knowing when to pause and get some advice is maybe the most powerful tool you have. This question right here, it's everything. Honestly, knowing the signs that mean you should pick up the phone and call a professional, that's a huge part of caring for yourself safely and making sure you get the best possible outcome. Okay, this is really important, so please listen closely. If your scar starts to feel hot to the touch, if it gets really red or swollen, if there's any oozing, or if you get severe pain, a fever, or any new bleeding, those are the signs to stop what you're doing and call your doctor right away. Don't wait. Here's another specific thing to look out for. It's called granulation tissue. And basically, it looks like little bright red, raw-looking spots on the scar that might bleed really easily. Now, the crucial thing here is do not massage this area. It's a sign that the body overdid it a bit on the healing, and it needs a very simple, quick treatment from a doctor to sort it out. Isn't it fascinating how our hormones are connected to everything? If you're breastfeeding, your estrogen levels are naturally lower, and that can sometimes make scar tissue feel a little bit tighter or more rigid. But the solution can be surprisingly simple. A topical estrogen cream prescribed by your doctor can make a huge difference in helping that tissue soften up. You don't have to walk this path alone. Having an expert, compassionate guide can make all the difference in the world. And that's why we want to introduce you to the kind of care you'll find at the Women's Health Clinic, which is led by a true specialist in this field. So let's talk about the expertise Dr. Farzana Khan brings to her patients. We're talking about more than 2 decades of medical experience, a special diploma in sexual and reproductive health, and a real deep focus on vaginal health, on comfort and function. In fact, she's so trusted in her field that she actually trains other doctors. You really are in the most compassionate, expert hands. And this quote, well, it just says it all, doesn't it? This is what it's all about. It's a partnership. It means you'll always get clear explanations you can understand. You'll know what to realistically expect. And most importantly, you will be a part of every single decision made about your own body. So, as we finish up, I want to leave you with this thought. Your healing is a journey, not a race. So what is that first gentle step that you can take for yourself? Maybe it's just learning a bit more about scar massage, or maybe it's booking a chat with a specialist to understand your options. Whatever it is, that first step is yours to take. And it's the beginning of the road back to feeling comfortable and confident in your own skin again.